Historically, for macular degeneration, we really haven't had anything, specifically for dry macular degeneration. For wet macular degeneration, that's the one you don't want because you get shots in the eyes. For dry macular degeneration, it's really been, let's just hope it doesn't get worse. Let's hope it doesn't turn to wet. So what can you do for dry macular degeneration? A couple things. For dry macular degeneration, there's things you want to do. For example, no smoking. You want to do things like eating spinach or taking vitamins, specifically vitamins that have antioxidant properties in them. Other things, for example, wearing sunglasses, wearing a hat, those can all be key things that you can do for dry macular degeneration. But now we actually have a treatment for dry macular degeneration. It's called the Valeda unit. Now, Valeda, what it's doing is it's using a combination of special light and it's shining that to the back part of the eye. So I think it's key first to note, number one is like, what's the Valeda unit? In order to understand that, we need to understand macular degeneration. Oftentimes when you go to the doctor, they take scans with these units here, and what they're taking pictures is a picture of the back part of the eye. Normally what happens, there's these key cells called rods and cones that catch the light. That's how we're able to see and why they told you to eat carrots as a kid. And what happens is the photoreceptors actually get nutrients from these special cells called the RPE. Okay, so imagine I'm the RPE and I'm pumping nutrients to the retina. It's able to get its nutrients and then I get rid of the waste products. What happens in age-related macular degeneration is the RPE says, I'm tired of doing all the work in this relationship. And instead of pumping, it gives nutrients, but it doesn't take away the waste products. And you get an accumulation of the waste products on Bruch's membrane, and that's called drusen. And this drusen can build up over time. That actually is called dry macular degeneration, when you have an accumulation of drusen or these waste products. And what can happen is if you have too many, you can get a break through the wall. Fluid can go in there and that turns to wet. So we want to avoid the waste products. We ideally would not want any kind of breakthrough. And now we have light that is able to focus on the retina. This special light is able to give energy to the RPE so that it's able to take away the waste products. And what we're seeing, if we take a look at these special scans here, we're actually able to see that the drusen gets smaller. And if the drusen gets smaller, so what? But what we're actually able to see with this unit is improved vision. In the FDA clinical trial, these patients gained 1 to 2 lines of vision. Now, it isn't for everybody. Not everybody gets better, but this is the first time we've had something that even had the chance to improve something and to improve vision in dry macular degeneration patients. So tell me a little bit more about this Valeda treatment. Well, it's just a light treatment that you would come into the office for. It takes about 4 minutes per eye. And there's a series of the lights that are coming on. You open your eye, you close your eye. But you're basically just putting your chin on the chin rest in your forehead there. And it does this treatment. We don't have to dilate you. Good news. You just come in and we do the treatment. Now, how many treatments did they do in the clinical study? They did a series of 9 treatments over 3 to 5 weeks. So you probably get 2 treatments every week for about 4.5 weeks. And in the study, they actually did this about 3 times a year. So downside, there are visits that are involved in this. In one cycle of treatments, it's about 9 times that you're coming in for these 8-minute visits of light treatment. And then doing that 3 times a year. So the big question that we have, I mean, this just got FDA approved. Do I need to actually do it 3 times a year? Do I do it once a year? The FDA clinical study looked at these patients over a 2-year period. And in this 2-year period, like we said, most patients gained vision. Now, there were some that didn't, right? If you still continue to smoke, you're not getting the right nutrients, that macular degeneration could not get better. It could get worse. I mean, so these patients have to be monitored. The other thing to note is in the longer term study data, what happened were some of the patients that stopped treatment at 2 years, they stopped and their vision did regress. But when they picked back treatments up later, their vision got better again. And so this is a new treatment. We're going to see really where this treatment fits in overall in the landscape of dry macular degeneration. There are a lot of doctors who are really excited that this is the future of treating dry macular degeneration. Could we catch all the patients who have dry macular degeneration early? And if we do, prevent them from getting to wet? Interesting question. And still, I mean, you might be moderate to severe macular degeneration. The question is, well, could we prevent it from getting worse and even improve the vision some? That's what we're looking at. Now, other questions that people have, like, does insurance cover it? Right now, most insurances don't. but the only way to find out would be come in for a consult and let's talk about it. So if you're interested in coming in for a consult, where we'll answer way more of your questions, feel free to give us a call, 830-830-2020. If you're outside of San Antonio, if you're inside of San Antonio, 210-210-2020. We look forward to seeing you guys soon.